everyone. This is Dr. Kavita Kaul. I'm a speech language pathologist and audiologist. I practice in Richmond, Virginia, and I specialize in auditory processing disorders.
And I am Dr. Elizabeth D'Souza. I am from Connecticut. I am a speech pathologist and an audiologist too. I specialize in auditory processing disorders too. Today we are going to be presenting you an article from the SSW series, Volume 1, Number 3 of May 1979. In the last recording, we saw about SSW as a site of lesion test. And in this article, we have more information on the same, and we found it interesting. So we are going to be sharing some interesting facts.
One of the interesting facts that we saw, again, it talks about how to differentiate deficits in upper brainstem, lower brainstem lesions, auditory reception area, which is the Heschel's gyrus, and the transhemispheric connectivity lesions.
Yes, one of the facts that I saw on this article was about the word discrimination score in brainstem lesions. As it differentiates between the upper and the lower brainstem lesions, the comparison of the word discrimination score shows that there is a greater deficit in the word discrimination score for lower brainstem when compared to the upper brainstem.
Also, deficits in the auditory reception areas and transhemispheric connectivity lesions show a pattern of peaks in the competing condition of the SSW score. The other interesting fact that was in this article tells you about the test performance on the competing environmental sound test and the staggered spondiac word test, both by Dr. Jack Katz. And it tells us how to differentiate lesions in the right and left auditory reception area. For example, in right-handed individuals, if you see a right side peak in the competing environmental sound test, it indicates a right hemispheric deficit. And if you see a left-sided competing word deficit on the left side in the SSW test, it tells you about the left temporal lobe deficit or lesion when you compare the two tests.
Yes, I found it very interesting because this was new information to me about the competing environmental test score, how diagnostic it is, and how when it's used with the SSW test, we are able to differentiate between the left and the right temporal lobe lesions. And we found a few other interesting studies reported here, which we are going to talk about, two of them. One of the studies was about the cochlear pathology and the SSW test. There was a study done with 12 cases of Meniere's and 10 cases of cochlear pathology. All except the 10 cases of cochlear pathology and 2 of the Meniere's, that is 10 of the Meniere's cases had abnormal SSW scores even in remission. That kind of points that there is a central involvement in a cochlear pathology in Meniere's disease case.
That's interesting. Maybe our viewers, if you have tested Meniere's disease patients, you can administer the SSW test and see if this still holds true. The next study that was reported here was about dyslexia. They found that 42% of the parent population of dyslexic children obtained a degraded test score in one or more listening conditions, with the competing condition showing the greatest abnormality. The statistical analysis that was done revealed significantly poorer SSW performance for the dyslexic children and their affected parents, especially in both the left competing and right competing conditions. These test results appear to support a genetic precursor theory for dyslexia, which we know now is true. And also, in my clinic, when I test kids who have been diagnosed with dyslexia, I do find the type A SSW pattern, which indicates a significant left competing condition difficulty, especially with those with right-handed individuals. And I do corroborate the dyslexia diagnosis, which is very useful.
I see it in my practice too. I hope this presentation has inspired all of you to go back to the original article to read more of the details that are there. And we hope that this supports you in your diagnostic decisions.
Yes, please visit our website, www.igaps.org. We will see you again here very soon.
Bye.
Bye-bye.